And I'm okay with not sharing your sandbox, but if the result of you not sharing the sandbox as a nurse anesthetist or an anesthesiologist means that I'm not going to be able to get the care that I need when I need it for the price that I can afford, I'm going to have a problem with that. And the more that all of these groups do these things, and the state licenses them and tells them what they can do, down the road we have, here in Harnett County, you have 2 hospitals fighting over who gets to build the hospital. Have you ever seen that happen with a gas station? Gas stations get to pop up anywhere. In Cary, where I live, a couple miles north of here, people were actually complaining a few years ago about the fact that there were too many grocery stores. It's awful. There's no reason to have another grocery store open up on the block. Somebody has to step in, planning and zoning have to step in and tell them that they can't open this grocery store. We have too many choices. It's awful. But certificate of need is something that the state does that says hospitals, no, I'm sorry, you may be in a 150-year-old building that's falling apart and decrepit, and you may not be able to fit the new equipment into it, but really you can't close down and move across the street without getting our permission. And when you get our permission, we're going to talk to somebody else. And sorry, you may have the best idea for a hospital or for an MRI outpatient treatment center or for anything else, but I'm sorry, there's just not the market for it. We, the state, have decided that there's not a market for it. And when you put that kind of power into people's hands, it really is giving them power of life and death. Markets aren't perfect, but if you open up an MRI center where there's not demand, you're going to find out. And you're either going to lower your prices or you're going to close. You're going to figure it out really quickly. My wife and I tried starting a business. We tried starting a running and shoe and clothing store. We tried opening a little too close to an existing business, and so we weren't even able to get the supply. We never got to the stage of finding out that we opened too close, and so we weren't able to get business. But think about what happens with gas stations. Right? If you have a gas station out in the middle of nowhere, it can charge a pretty good price. But if you have 4 gas stations on a corner, which you see sometimes, what happens to the prices there? They're a lot lower, right? You end up with a lot lower prices when you have competition. So why not allow people to make the decisions for themselves and allow the doctors to compete with each other? And really, I was going to stop with that slide, but really, the president, when he talks about that we have to have a government option to provide competition, this is what government competition looked like in East Germany. This is the Trabant. They made that car as long as there was in East Germany. If government competition was really good, when people thought about German cars, they would think about Trabants and not BMWs. Because the Trabant would look a lot better. So, this is a beautiful car. I'm sorry, I grew up in Detroit, I love cars. And that's beautiful. That is not something that you would design to succeed in the market. That is. And think about taking it another step further. Nice private institution here. The president went to a wonderful private school, Harvard. There's a public school pretty close to there, UMass. Is Harvard the elite school that it is because UMass is down the road? Is Sidwell Friends School, where the president is sending his daughters, a great school because it has to compete with the DC public school system? Or is the DC public school system going to charter schools and improving its standards and having is the superintendent there saying that we have to have private vouchers and tax credits to allow parents to put their children in effective schools because the government schools are failing? And even the president himself admits that when you take a look at delivery services, the president said, it's not UPS and FedEx that are struggling, they're doing fine. It's the post office that we have to keep bailing out. And the post office, the main reason why it gets to subsidize and have lower prices than the delivery services where it competes is because it has a monopoly in the first class and bulk mail areas. So it has this monopoly over here where it can provide cross subsidies, and it still doesn't charge enough in there to be able to compete in the other area. It keeps losing money, and it keeps raising the prices of stamps and everything else that you and I pay for when we go to there. So I'm not sure how government competition, which gave us the Trabant, can succeed, can do exactly what the president says, unless it does what the president says it won't do, which is get subsidized. Even the co-ops that are being talked about will get billions of dollars in subsidies right at the start, right up front, to be able to compete and be able to outcompete their competition. And finally, the president talks about, and lots of people talk about, how profits are evil, and how profits are driving the insurance companies to rake people over the coals and keep them from getting the treatment that they need because they make money every time that they deny treatment. Well, I mean, in most families, you consider profit savings, right? Savings is a good thing so that you can pay for your education, or you can pay for a car, or you can pay for a house. You can do the things you want to do. You can retire, you can stop working, right there. That's the goal. But the largest insurer in the state of North Carolina, and the largest insurer in just about every state, is not even a for-profit company. It's a non-profit entity called Blue Cross Blue Shield. Blue Cross Blue Shield in the state of North Carolina, depending on which sector of the market you're looking at, controls between 75 and 90% of the market. That's a non-profit organization that, because of state regulations, is able to keep out any effective competition. That's the problem with insurance the way it works now, and with healthcare the way it works now. Everybody who's in there has the voice of somebody in government that they can keep out the people that they would compete with them. I'm no longer than I planned, but I look forward to your questions.